Here with David Shuster tonight. We're joined by Congresswoman Rosa DeLauro. She is a Democrat from Connecticut and also an ovarian cancer survivor. Congresswoman, great to have you with us tonight.
Wonderful to be with you tonight. It's a special night.
What does this moment mean to you?
Well, it's very, very special. It is historic. When I think about this legislation in the legal Social Security and Medicare, it has the ability to transform people's lives. And if you think about why we come to this institution, you know, it's not what the institution does day by day, but historically, this has been an institution that has made great changes in people's lives, provided real opportunity. And I mentioned Social Security, I mentioned Medicare. You earlier were talking about civil rights legislation. This is in the league with these kinds of efforts, and that means to the American people that the Congress has acted on their behalf, and that in fact they are going to be able to afford health care, access it, and no longer have to live in the world of the insurance companies where they can be denied health care coverage for almost any reason, and even if they have health insurance. And women in particular are going to see that that gender rating is gone, that they will no longer pay 48% more for their health insurance than men do for the same coverage, that maternity care is going to be provided for, that older Americans, older women who will see the donut hole filled, that mammograms, colonoscopies, and other preventive screenings can be accessed without cost. It is really transforming for this nation. And you know, when I ran 20 years ago, little did I know or dare to believe that I would be here tonight and have the opportunity to participate in the debate, the discussion, and to vote for health care for this country.
Congresswoman, if you had had insurance, would you have beaten ovarian cancer?
The fact is, and let me put it this way to you, and I am an ovarian cancer survivor, and I know that my family had the wherewithal to take care of me, and I had coverage to deal with this. And that is not the case for so many women today. And that means that you are potentially doomed to death. That is what this bill is about. It is about life. 45,000 people every year die because they don't have health insurance. I met a young woman from East Haven, Connecticut. I saw her in a restaurant in New Haven not 2 weeks ago. And she stopped me because she waited for me to leave the restaurant. And I said, "Why didn't you come over to the table?" She said, "I didn't want to bother you." And her name is Melissa Maritoli. And she said, "Please, Rosa, pass health care. I have lung cancer, and pre-existing condition is killing me. I also can't leave my job because if I lose my job or if I leave it, I cannot get insurance." That's what tonight is about.
It is. Congresswoman, I want to ask you about the executive order and some of the language that's in the executive order. It's being reported that some of that language caught some Democrats by surprise. Is this going to be a problem, or is that issue past the House members and everybody's on board from the pro-life group with Bart Stupak?
No, everyone is on board. The White House issued an executive order. The White House talked with the pro-choice members, pro-life members, with advocacy groups.
So there's no surprises here.
There are no surprises, and I think, like some of the other issues that were debated and discussed, like geographical and regional disparities, that these had to come to a conclusion where people from rural, from urban, pro-life, pro-choice had to sit down and focus in on what was the common ground, because above all, the focus and the goal was to pass health care, and with regard to the abortion issue, to pass health care and to make sure that we were going to maintain current law.
Well, Congresswoman, just to be absolutely clear, and to follow up on Ed's point, I mean, there were a number of reports earlier that several members of the pro-choice caucus had not seen the language in the executive order until it was released publicly. We asked Congressman Clyburn and he said it was your responsibility to make sure all of the members got briefed. So when you're saying that they were briefed, they did know the language, I just want to be absolutely clear that we're getting the right story on that.
Well, you're getting the story from me, which is that the White House briefed simultaneously pro-choice members. They probably didn't they didn't brief everyone or the same. They didn't brief they had a representative group with the leadership of the pro-choice caucus and others, and the same with the pro-life caucus. And as I said as well, they briefed advocacy groups, and there was again the view that we could achieve common ground, that current law was going to be maintained, and that we could move forward. So everyone is aboard, and I haven't heard from folks about being disappointed or unhappy, but the point is that the language, as it's read, does not go beyond current law. Let me also say this, for those of us who are the pro-choice caucus, we don't like the Hyde language.
Yeah.
We never have. We worked to try to defeat it. We don't like the Nelson language, and would have wanted a different outcome there. So that the fact was, though, that we agree was on maintaining current law.
Congresswoman, thank you. I appreciate your time tonight so much.
Thank you. Take care.
You bet. Rosa DeLauro with us tonight from Connecticut. We've got so much more coming.